Madam President, I wanted to speak rather personally about health care reform, why I support the bill that has been signed by the President and why I support the reconciliation bill, and while I will oppose any amendment, no matter how good that amendment may appear to be. I am a doctor's daughter, and I'm a former doctor's wife, so I've lived most of my life in a medical family. I have had very good health care. My father, who was chief of surgery at the University of California Medical Center, never operated on anyone that he didn't make a house call on. He was well respected by his students and a great surgeon. My husband, who died, was a neurosurgeon, and his practice was spent in stereotaxic surgery with respect to people who had abnormal movements and couldn't control their movements. And so I came to really believe that we had the best medical system in the United States of America. And it was only through the last few years that I began to see how much medicine had changed in America. And when you walked into a doctor's office, it wasn't like one secretary in my father's office. It was a bank of files and a pressure and lines waiting to be seen. And I realized that there were so many people that didn't have good health care, that worried about losing their health care, and in fact are losing their health care, that this kind of reform suddenly was open to me. Then I looked at some statistics, because I thought America spending all this money, spending nearly 15% of our GDP on health care, we must be getting substantial bang for the buck. And here's what I found instead. According to the World Health Organization, the top healthcare systems in the world begin with France, #1, Italy, and it goes on, and the United States is ranked 37th. So let's go on. Infant mortality. I think infant mortality is a good criteria of care because we know with good medical care, you save babies. And I thought, surely, America's going to be #1 in terms of infant mortality. No, we're number 22. And in fact, Japan is at the top with 3 deaths per 1,000 births. So let's look a little further. Avoidable mortality rate. This is death that you can avoid with good medical care. Well, we have great medical institutions. You would expect that we would rank very high. Again, France is #1, and the United States is not 2, 3, 4, or 5, but number 15. And the source of that is the Commonwealth Fund. Well, I then began to think more deeply about it and to realize that we have all these people in this country growing that are uncovered. And in fact, in California, my state, a state of nearly 40 million people, in the last 2 years, each year, the uninsured have gained 1 million people. So over the past 2 years, California has lost insurance for 2 million people, bringing the total of people up to 8 million who have no insurance whatsoever. Then you see about companies that when people get really sick with HIV, with full-blown AIDS, will just simply cancel their policy and throw them out. And then you learn that there's such a thing as a pre-existing condition, and we all come with certain pre-existing conditions, or probably at one time in our life we'll have one, and we find there are companies that won't grant insurance if you have a pre-existing condition. And in my 17 years in the Senate, 18 years in the Senate, we've had numerous people write and say, I have been denied this treatment, or I have been denied that treatment. Would you please try and help me? And we do. And sometimes we win. And we get a procedure for them that they had been denied by their insurance company. So it is so important to know what this bill will do, that it will essentially cover 32 million, or 95% of the people of this country with some form of insurance. And when the exchanges are functioning, they will have real choice if they wish it, that their insurance will not be taken away from them. Right away this year, yesterday, those of us that were at the White House heard the president say that immediate gains will take place. For example, $5 billion for a high-risk pool, helping to provide coverage for those who are uninsured because they have been denied coverage by one of the big medical insurance companies. Also, children with pre-existing conditions can no longer be discriminated against, so that the family with a juvenile diabetic who can't get insurance because the child is a juvenile diabetic will be able to get that insurance. And that is really important. We've learned that the notorious donut hole, which takes place when you spend a certain amount on your pharmaceuticals, there is a hole in the middle at which point there is no help. And each person in that situation would receive $250 to help them through that time. And that a child can remain on a parent's policy until the age of 26. These are some of the things that happen right away. Now, I know people don't like this plan, some of them, but the question comes, do we keep doing what we're doing, spending more and more of our gross domestic product, and not really improving our overall performance, not improving our infant mortality, not improving our longevity the way good practical medicine should? Now, I want to talk about one thing that isn't in any bill that I'm very much worried about. A while ago, I introduced legislation for a medical insurance rate authority. We have about 9 very large for-profit medical insurance companies in the United States. As a product of an earlier action, they're the only industry other than Major League Baseball that has an antitrust exemption. And so what they have been doing is merging and acquiring companies so that they can control markets. In Los Angeles, for example, today, 2 of these companies control 51% of all of the premiums in Los Angeles. And once you have this market share and control, you can raise premiums with abandon. And so earlier this year, a company, a subsidiary of WellPoint, sent out notices to 800,000 Californians and said, we are raising your premiums, and these premium raises went up to 30% for those not in a group policy, but who held individual policies. Can you imagine getting a notice that your insurance has gone up 40%? And to add insult to injury, they then say, and we may come back in the middle of the year and ask for another. Well, that company came in, and so I asked the CEO what her salary was, $9 million a year. And you realize that these companies also have a substantial percentage that they spend on rent of your premium dollar, on the salaries of their executives in the millions, on your premium dollar, on transportation, on conventions, and generally this can go to 20 to 30% of the premium dollar. Well, we begin to bring it down to 15% of the premium dollar. What is missing, and what the president put in the reconciliation bill, was my legislation to give the Secretary of Health the ability to see that medical insurance premiums are reasonable, and would establish a rate authority of people who have expertise in the arena that she could consult with in levying this authority. That, Madam President, is not in the bill.
The senator has used 10 minutes.
If I might just conclude,
Without objection.
These rate increases go into place May 1. So it is vital that we take some action before May 1, or all throughout the United States, there are going to be substantial premium increases.